Good afternoon. I'll be speaking on the topic of OCT, the key to dilemmas in disc edema. My name is Dr. REJO CYRIAC. I'm from Sri Ramachandra Medical College. I'm a junior resident. I just wanted to start off by showing this fundus photo of a patient with evident disc edema, followed by another patient which we saw in the OP with a disc edema. Now, both patients, to clinically alone to diagnose and differentiate these patients would be difficult. So we did a OCT scan for both patients. The first patient, we noticed that the arnophil thickness was substantially high, while the second patient, not so. Now, after further investigations, we came to the conclusion that the first patient had papilledema, while the second one was pseudopapilledema. Papilledema is the passive disc swelling associated with raised intracranial pressure, while pseudopapilledema, there won't be any clinical evidence of raised ICP. It can be caused, pseudopapilledema can be caused by optic disc drusen's myelinated nerve fibers. In our study, the aim was to determine the significance of SD-OCT as a non-invasive tool in differentiating and diagnosing true papilledema from pseudopapilledema. The methodology, our study design was an analytical cross-sectional case control study. Our sample size was 21 patients with papilledema, 20 patients with pseudopapilledema, and 40 controls. The duration was for 1 year. Inclusion criteria for papilledema patients: all patients with established papilledema with clinical evidence of raised ICP was taken with further investigations. And pseudopapilledema, we took cases of optic disc drusen's, which was confirmed on B scan. Now, all cases in the study groups were subjected to a thorough retinal examination. On fundus examination, OCT scans of patients with disc edema was taken. All the scans were interpreted by a single examiner using spectral domain optical coherence tomography. Each patient underwent an optic disc scan of 200 into 200. The average arnophil thickness and quadrant-wide arnophil thickness was taken in all three groups, and one-way ANOVA was done to look for variability within and between the groups. ROC curve was also done, and p-value of lesser than 0.05 was considered as significant. Now, when we observed the mean arnophil thickness in papilledema, pseudopapilledema, and controls, the mean arnophil thickness in all quadrants was greatest in papilledema, followed by pseudopapilledema and controls. In both papilledema and pseudopapilledema, arnophil thickness was greatest in the superior quadrant and least in the temporal quadrant. And when we looked at the p-value, this is just a tabular column showing all the p-values and all the data, where every mean arnophil thickness had a significant value of lesser than 0.05. The area under the curve for in all quadrants were significant, and all quadrants and average arnophil thickness readings, the maximum value were seen in superior and inferior quadrants in papilledema versus pseudopapilledema groups, indicating its capabilities in differentiating the two. When comparing papilledema and controlled groups, area under curve was greatest for average and superior arnophil thickness. In papilledema versus controls, we observed that the area under curve was greatest for temporal, followed by superior arnophil thickness. Now, in our study, we found that the mean arnophil thickness was highest in all quadrants in papilledema groups when compared to both pseudopapilledema and controls. In some cases, however, we noticed that pseudopapilledema had greater thickness than papilledema in certain quadrants. This could be explained by the fact that the arnophil thickness in pseudopapilledema varies depending on the site of the optic disc drusen. However, this can be avoided by comparing the average arnophil thickness values. In a study done by Bassi et al., very similar variables were taken, where median arnophil thickness and total retinal thickness was taken. The TRT values was useful in diagnosing papilledema and pseudopapilledema from controls in their study. In our study, however, TRT values were not taken. However, it was observed that the average and all quadrant-wise arnophil thickness showed statistically significant results in determining papilledema from pseudopapilledema, and highly significant results in diagnosing papilledema and pseudopapilledema from controls. The conclusion we came to was that SD-OCT can be useful in diagnosis of patients with blurred disc margins. It can help in differentiating true papilledema from pseudopapilledema in patients where there are no discernible clinical features, and can be used to raise clinical suspicion for further investigation. The limitation in our study, however, was that the sample size was quite small, so it will be difficult to extrapolate the findings into a larger population. Thank you.
nicely done study, but to make it more impactful, you probably would have to also look at the pattern. I mean, it's just the number would not differentiate between true or pseudo, or to go forward as to what did the OCT picture show. Well, there are various angles which have been described in the literature, and if you look at it, probably will have even more meaningful impact, but very nicely studied and presented.